Santiago, and with my classmates, we're going to talk about effects of one or two treatments with prostaglandin F2 alpha on subclinical endometritis and fertility in lactating dairy cows inseminated by timed artificial insemination.
The introduction. Uterine diseases are prevalent in dairy cows and they have been associated with reduced reproductive performance, which ultimately affects her profitability. Uterine diseases are often classified according to clinical presentation and defined based on their effects on pregnancy, per artificial insemination, or time to pregnancy. The clinical endometriosis is defined as presence of inflammations in the reproductive tract, visible by the type of vaginal discharge that typically contains pus and persisted after 21 days. An alternative therapy is the use of prostaglandin F2 alpha in an attempt to induce estrus and eliminate bacterial contaminations that may be causing the inflammatory process in the endometrium. Use of prostaglandin F2 alpha in cows during the estrus results in luteolysis and induces cows to return to estrus, which has been suggested to enhance uterine immunity by removal of immunosuppressive effects of progesterone, suggested that the improvements in PAIE caused by prostaglandin F2 alpha in postpartum cows were caused by inducing estrus and the concurrent opening of the cervix and myometrium contractions that might enhance mechanical cleansing of the endometrium. The goal of the current study was to demonstrate an improvement in PAI in dairy cows with the systematic use of prostaglandin F2 alpha by enhancing uterine health based on the reduction in the prevalence of subclinical endometritis. The hypothesis of the current study was that treatment with prostaglandin F2 alpha would reduce the prevalence of subclinical endometritis and improve first herbice PAI in cows subject to a pre-synchronized time artificial insemination program. Therefore, the objective were to investigate the efficacy of systematic use of one or two treatments with prostaglandin F2 alpha, presiding a pre-synchronized time artificial insemination protocol on the prevalence of subclinical endometritis and PAI in lactating dairy cows. Materials and methods. A total of 1,342 lactating Holstein cows. Cows enrolled in the study covered from August 2009 to July 2010. For lactating Holstein cows weighing 650 kilograms, consuming 24 kilograms of the egg and production for 5 kilograms of milk containing 3.5% fat and 3.1% to protein during the first airing of lactation. The first insemination for cows in the study occurred between November 2009 and October 2010.
Treatment and body condition scoring. A body condition assessment of 1 to 5 was performed on all animals in the study, where 1 is a thriving animal and 5 is an obese animal. On the other hand, in the study animals, the designation of receiving or not receiving treatment was made randomly in turn to who the difference that they have a different number of days in milk, and their sample was somewhat different.
Okay, in the reproductive management of this study, they are classified in three groups: control, 1 prostaglandin F2 alpha, and 2 prostaglandin F2 alpha. Yes. In the first group, no prostaglandin treatments were performed in this group before the Obsenge double synchronization protocol began on day 48. In the second group, prostaglandin F2 alpha, the treatment with prostaglandin were performed once on day 39 and one day 48. The double protocol of Sinch was initiated. In the third group, to prostaglandin F2 alpha, the prostaglandin was twice supplied before initiating the Obsenge protocol. The first administration took place on the 25th day and the second on the 39th day. Finally, on the 48th day, the double protocol of Sinch was initiated. Okay, the Obsenge protocol has 6 administration of different drugs. Okay, on day 48, they administered GnRH because the drug induces ovulation or luteinization of the corpus luteum. On the 55, prostaglandin F2 alpha because induce regression of the corpus luteum. In the 58, again there was administered GnRH because induce peak of LH and ovulation of the follicle. On day 65, applied again, administered again GnRH because this drug induces ovulation of luteinization of the corpus luteum. On day 72, again prostaglandin F2 alpha because induces luteal body regression. On day 74, again GnRH because induces LH peak and follicle ovulation. In the other part, the evaluation, they have uterine health evaluation. Yes, they did 3 evaluations. The 3 evaluations were performed in all groups before the Obsenge protocol began. On day 25 was carried out evaluation by uterine cytology and evaluation of uterine discharge. On day 32 was performing only uterine cytology. And finally, on the day 46 was performing uterine cytology. After of all of that, they did artificial insemination And this procedure was performed on day 75, just 2 days after the Opsich double protocol process was completed.
Bacterium similar and the three treatments 2.93 more or less 0.05 dice in milk. Similar enrollment 24.7 more or less 0.05 versus dice in milk. At all 18.1.0 more or less 0.2. Vaginal discourage score on day 25 postpartum 2.08 more or less 0.06. Percentage of polymorphonuclear in endometrial cytology on day 25 postpartum 6.98 more or less 0.67. Body condition scoring at enrolling was greater for control and 2 prostaglandin A than for 1 prostaglandin A code. Control 2.96 more or less 0.02 versus 1 prostaglandin A. Effects of prostaglandin A treatment on the prevalence of endometriosis subclinica. The prevalence of prurient vaginal discharge on day 25 postpartum tended to be greater for cows in 2 prostaglandin A than those receiving 1 prostaglandin A. Control cows had intermediate prevalence that didn't differ from the other two groups. The prevalence of endometriosis subclinical in cows on day 25 postpartum before treatments were applied didn't differ among treatments. Treatment with prostaglandin F alpha and 25 days in milk in 2 prostaglandin F reset the prevalence of endometriosis subclinical on day 32 postpartum compared with control and 1% COV. No association was observed between parity, body condition score, and season of all with the prevalence of endometriosis subclinical.
Effects of prostaglandin F2 alpha on pregnancy per artificial insemination and pregnancy loss. Treatments with 1 prostaglandin F or 2 prostaglandin F failed to increase pregnancy per artificial insemination on day 32 and 60 after insemination in cows synchronized and bred with the double or single time artificial insemination program overall. 39.9 and 35.2% of the cows were pregnant on day 32 and 60 after artificial insemination respectively. Pregnancy loss between 32 and 60 days after artificial insemination affected 11.9% of the pregnant cows, and treatment with either 1 prostaglandin or 2 prostaglandins had no influence on maintenance of pregnancy in the first 60 days of gestation. Parity and season of artificial insemination affected pregnancy per artificial insemination on day 32 and 60 after time insemination. Primiparous cows had greater pregnancy per artificial insemination than multiparous cows on day 32 and day 60 after artificial insemination. Cows inseminated during the cool season had greater pregnancy per artificial insemination than those inseminated during the hot season on day 32 and day 60 after insemination. None of the other covariates evaluated influenced pregnancy loss between 32 and 60 days of gestation per artificial insemination. Association among purulent vaginal discharge and subclinical endometritis with measure of fertility. The negative effects of uterine disease on pregnancy per artificial insemination and maintenance of pregnancy were only observed when cows were diagnosed with both purulent vaginal discharge and subclinical endometritis on day 32 and 60 after insemination. Cows not diagnosed with uterine disease had greater pregnancy per artificial insemination than those diagnosed with both. However, pregnancy per artificial insemination did not differ statistically among cows not diagnosed with uterine diseases and those diagnosed with only purulent vaginal discharge or subclinical endometritis. Cows diagnosed with both diseases had lower pregnancy per artificial insemination on day 60 than those diagnosed with only either purulent vaginal discharge or subclinical endometritis. Similar to pregnancy per artificial insemination, pregnancy loss increased only when cows were diagnosed with both purulent vaginal discharge and subclinical endometritis. Subclinical endometritis depressed pregnancy per artificial insemination and increased pregnancy loss in dairy cows, but these negative effects were only observed when the disease persists until 46 days in milk. Of the 50 cows categorized as having persistent subclinical endometritis, 19 had the first diagnosis with more or equal 5% of polymorphonuclear leukocytes at 46 days in milk, and the remaining 31 had an early diagnosis. Cows with no diagnosis of subclinical endometritis had similar pregnancy per artificial insemination on day 32 or 60 after insemination compared with cows diagnosed with subclinical endometritis that resolved by 46 days in milk. Nevertheless, those cows in which subclinical endometritis persists until 46 days in milk immediately before enrollment on the double Cinch protocol tended to have lower pregnancy per artificial insemination on day 32 and had lower pregnancy per artificial insemination on day 60 after insemination because of greater pregnancy loss that caused that resolved to clinical endometritis by 46 days in milk. Conclusions. First, treatments with 1 or 2 injections of prostaglandin F2 alpha in early lactation before cows were subject to a presynchronized time artificial insemination protocol was unable to improve uterine health and measures of fertility in lactating dairy cows. Second, subclinical endometritis impaired pregnancy per artificial insemination and maintenance of pregnancy in lactating dairy cows, particularly when associated with purulent vaginal discharge, and the negative effects of subclinical endometritis was observed when the inflammatory process persists until 46 days in milk. Third, when both purulent vaginal discharge and subclinical endometritis were associated or when subclinical endometritis persists until 46 days in milk, pregnancy loss increased.